primary provider at Desert Star Family Planning in Phoenix, Arizona. Decided to go live a couple of moments early today so we can give people the opportunity to get the notifications and join us. So I'll just wait a few moments here. It's 11:59, not quite 12 p.m. yet here in Arizona. I hope everyone is doing well. Say hi, let us know you're here. I'm looking forward to a good discussion today. I will be discussing gender affirming care. Welcome. Again, I'm Dr. DeShawn Taylor. I am a gynecology and family planning specialist, and I am the owner and primary provider at Desert Star Family Planning in Phoenix, Arizona. Today, I will be talking about gender affirming care. Welcome. I do Well Women Wednesdays every second and fourth Wednesday of the month at noontime in Arizona. We're now on Pacific Standard Time. And so today is a bonus discussion that I wanted to do today on gender affirming care. And I've decided that I'll definitely do the Tuesday, the second and fourth Wednesdays, and then I may do some extra content here and there on the off Wednesday. So definitely stay tuned to receive the notifications when we'll be doing the extra content. And so why am I talking about gender affirming care? Because regardless of your gender identity, you deserve access to safe, comprehensive health care. And my approach to healthcare in general is to provide patient-centered care. And so I am here to partner with you to live your healthiest and most authentic life. Desert Star Family Planning has always been a safe space for LGBTQ plus people. But several months ago, I started to think about how I can be more intentional about serving people specifically in the trans community. Because transgender and gender nonconforming people face discrimination in all aspects of their lives, including at the doctor's office. And so a few months ago, I started working on bringing a gender affirming care service to Desert Star Family Planning. And I'm so excited to be able to start offering services this Saturday, March 20th. As an abortion care provider, I understand the judgment and discrimination people experience trying to access health care that they have the right to. Everyone deserves just, dignified, and exceptional care. And so for those watching who don't quite understand what transgender is, I do want to provide a basic foundation for you. Now, the terms biological sex, biological male or female refer to physical aspects of maleness and femaleness. And these may not always be in line with each other. So for example, a person with XY chromosomes may have female appearing genitalia. And so these terms, biological sex, biological male, biological female, is quite imprecise and should be avoided. And in preparing for in preparing for this discussion, I realized that I need to make some adjustments on the language on my own website. Now, another term that I want to clarify is sex designated at birth. And that refers to the sex assigned at birth, usually based on genital anatomy. As we start to talk about gender affirming care, it's important to understand the difference between gender identity and gender expression. And so gender identity refers to one's internal, deeply held sense of gender. For transgender people, their gender identity does not match their sex designated at birth. Most people have a gender identity of man or woman, boy or girl, But for some people, their gender identity does not fit neatly into one of these choices. So unlike gender expression, the gender identity is not visible to other people. Now, gender expression refers to external manifestations of gender. So this is expressed through one's name, pronouns, clothing, haircut, behavior, voice, or body characteristics. And so typically transgender people seek to make their gender expression align with their gender identity rather than their designated gender. So transgender is an umbrella term for people whose gender identity and/or gender expression differs from what is typically associated with their sex, designated at birth. And not all transgender people seek treatment. And so we generally speak to people being transgender men or transgender women. And so a transgender male is an individual assigned female at birth, but who identifies and lives as a man. And the transgender woman is an individual assigned male at birth, but who lives and identifies as a woman. And so when people are seeking to overtly exercise their gender identity and expression, they go through something called a transition. And so transition refers to the process during which transgender individuals change their physical, social, and/or legal characteristics consistent with their affirmed gender identity. So gender affirming care is a highly personalized and patient-focused approach to healthcare for transgender people. Although medical transition is a big part of healthcare for transgender people, it is more than just medical procedures and hormone treatments. It allows you to access the medical care you need without judgment or fear, ensuring that you receive the interventions and treatments you require to remain healthy. And so at Desert Star Family Planning, this looks like hormone therapy or not, wellness exams, sexually transmitted infection testing and treatment, vaccination against the human papillomavirus, HPV for short, which causes genital warts and cancers of the genital organs and the throat. And so I'm going to go a bit more in detail about hormone therapy. For transgender patients who desire hormone therapy, we will have an initial consultation to review your medical history, do some laboratory testing, and determine the goals you want to achieve with hormone therapy. Transgender men will be prescribed a hormone called testosterone, which causes the menstruation to stop, increases facial and body hair, increases muscle mass, and redistributes fat. It also deepens the voice and increases sexual desire. Some of the less desirable effects include increased oiliness of the skin and male pattern hair loss if that is something that runs in your family. Now, transgender women are prescribed a couple of types of hormones to increase their estrogen levels and block testosterone activity. And so the estrogen prescribed is called estradiol. And the most common medication prescribed to block the testosterone effects is called spironolactone. The result of these medications for transgender women are to decrease facial and body hair, and this is usually mild, redistribute fat, and increase breast tissue growth. And so breast development, though, is generally maximal at 2 years after initiating hormones. So there could be some time of taking the hormones before we see full breast development, if at all. The hormone therapy also decreases sexual desire and spontaneous erections. And over a long period of time, the prostate gland and the testicles shrink. So as we're going through this transition, I'll monitor your hormone levels and the effects of your treatment to ensure you remain safe and healthy during treatment. I also want to be clear that gender-affirming hormone therapy is not effective birth control. So transgender individuals with retained reproductive organs who engage in sexual activity that involves sperm and oocytes, also known as eggs, will also need to discuss birth control options with me to avoid becoming pregnant or causing pregnancy for someone else. Everyone needs annual wellness exams. And I understand that these exams can be distressing for transgender individuals, and we will build a relationship of trust. And when you are ready, I will take my time to ensure your comfort for your more intimate exams and cancer screenings. I am a big proponent of screening everyone for sexually transmitted infections. As I discussed last week in my live session about the serious complications of untreated chlamydia for women, most people who have sexually transmitted infections do not have symptoms. I want you to know your status and test as often as needed based on your risk factors for infection. Desert Star is a judgment-free zone. You will feel safe, accepted, and respected. And in terms of HPV vaccination, almost every person who is sexually active will get the human papillomavirus at some point in their life. Now, most HPV infections will go away on their own. Our body clears them. They don't cause issues. However, infections that do not go away can cause certain types of cancer of the genital organs and throat. So HPV vaccination protects people against cancers caused by HPV infection, and it also protects against genital warts. And this vaccine is important for people of all genders. Now, people might ask, you're a gynecologist. What are you doing with gender-affirming care? Special certification is not required to provide gender-affirming care. As a physician, I am knowledgeable about the medications used for gender transition and the potential risks and side effects. And there was an unmet need for affirming transgender care for our Black, Indigenous, and other people of color. And I am committed in racial, gender, and reproductive health and justice. And I am excited to combine my medical expertise and care with community building to help transgender and gender nonconforming people thrive. So if you are in the Phoenix area or can get to Phoenix, I invite you to partner with me for compassionate and customized gender-affirming care. Thank you so much for joining me today. And you guys have a great Wednesday and rest of your week. See you next Wednesday.